here, a few minutes?
Just a couple minutes. Maybe 5 minutes. I was in the nurse. Did all this shit, you know?
Yeah.
My heart, my blood pressure was okay, and everything was okay, you know? Just fucked up, man.
All your blood pressure's okay?
My blood pressure was okay.
Pulse, everything?
Yeah. Just very lightheaded, nervous, like I would have fainted. My eyes, like it's like a little blur, you know. That's why I'm using my glasses, you know, straighten it out.
One second, guys.
Hello, Doc. How are you?
Good, good. How are you?
What's going
Good, man.
How are you?
Great shape.
Are you feeling well?
No, it seems terrible.
You do. I'm sorry.
Real bad.
I had to see the other gentleman ahead of you. He ended up having a silent heart attack, and he's also a patient of mine that I see now and then. So
Oh, okay.
nobody wants to go to the hospital because they don't do anything in the hospital. Why did you have the brain scan done?
Some real lightheaded and stuff.
Okay. I'm glad they looked at the arteries. Who ordered the test?
Lane.
Dr. Leanne?
Yeah,
Okay. And how's the lightheadedness?
very lightheaded. And I feel like I'm going to faint and stuff.
Are you- When did that start?
About 10 days ago,
10 days ago?
9 days ago, something like that.
Any drainage in your nose or anything like that?
Yeah, a little bit.
Any fever?
No,
Any coughing up anything?
no.
Okay, what were you gonna say? 8, 9
He
days?
said, I know, I thought you said you started when you're around your birthday.
Oh, mine is
When was your birthday?
February 27th.
Okay, so about a month.
It got worse and worse. So.
That's fine, because there's a lot of wind in the air, and a lot of people have hay fevers, and sometimes if the bug goes inside the brain or the inner ear, it can cause balance issues. And vertigo or dizziness or lightheadedness, it's a very difficult diagnosis to make. So you were having dizzy lightheadedness for about a week or two, let's say, or longer, and you saw Dr. Leanne. Did you
They
pass out?
I was going to call ambulance, and they said come by them first.
Yeah, that's
They checked-
fine.
They checked everything I
Good.
checked out already.
Blood pressure, heart rate, they checked a few
Everything
things
was
out.
all right.
Okay, very
And
good.
then over the weekend, I felt like I was going to faint and stuff, so
You
I
did?
didn't want to call ambulance, so
Okay,
my daughter called and made my appointment to come this Monday instead of Wednesday.
that's fine. Now these are beautiful, beautiful, beautiful images. I mean, just wonderful images. I don't know if you know, but this is a three-dimensional view, and this is your arteries going to your neck. Just beautiful images,
Yeah.
you know? There's a blockage where it pinches right there. So I gotta see how they read that, you know? These are the films. Looks like there's a blockage in the neck, you know?
Yeah?
Did he go over the results with you?
No.
No, okay. So if it is true, and most surgeons do not use these images to fix the blockages.
Okay.
They still require a traditional angiogram. But let's assume this shows a tight blockage in the neck. Then that could explain some of the lightheadedness, the dizziness, or passing out.
I'm a little, my eye, I can't, a little blind or.
Are you on Plavix still?
Yeah.
Okay, so I'll just show you. This pretend you're in a helicopter looking at a road.
Okay.
Okay, this white color is the artery, and the darker color, the bones are here, and this is the muscle. So this is the blood going from their heart up to the brain.
Okay.
And do you see that little dark area there?
Yeah.
That's where there may be that blockage, or that dark area may represent cholesterol fat. That's what it represents. So these are images from outside the body. They're good, wonderful, but they're not as accurate as being in the body.
Right.
So when we do surgeries, we prefer to look from inside out. Now that carries a little bit more risk because you're injecting in the artery instead of the vein over here. But that's probably why that blockage appears to be significant. But I don't have the official report, so we'll have to get the official report.
Okay.
You know?
Yeah.
But it's a beautiful, beautiful picture.
Yeah.
You know.
I
Technology.
keep on feeling real bad. I'm not eating as much.
Well, I don't know if that's related to this, that could be just a virus or flu, if you're not eating well or that type of thing, you know?
That's what I'm saying, I don't know what that was.
But nothing dangerous. So we'll take care of it, okay? Where were these done at, Desert Radiology?
Yeah.
Okay. And what's nice about them is they,
Why am I feeling so scared and nervous?
because we're scary people, that's what doctors are. And every time you come and see us, we
No,
give
no,
you...
no, I mean, at home, it's been like that for the last week.
Don't know, I wouldn't worry about it though. We'll fix it, don't worry. But we get, people get scared seeing us all the time, that's how it is
No,
for
I
us.
mean, it's not seeing you, it's
Just do you feel that way?
Yeah.
Okay, well, I don't know, and I'm not worried about it, and you're on Plavix, it's a darn good drug, okay?
Okay.
So I'm glad you brought these films in, but I don't actually have the report, so we need to find that report from me, okay? So it's a new problem, huh?
Yeah. Now I won't even, I'm so scared, when I
When
do
was
my,
this done?
I was walking 3 miles a day, now I don't even walk, I don't do anything now. The last week I haven't did no exercise, no walking, no nothing, because I'm scared I'm gonna faint.
Okay. Well, let's go over this picture first, okay?
Okay? Everything is a big job, take a shower is a big job, shaving, everything, it's just started.
Okay. Any particular anniversaries this last month?
No.
Anything coming up?
Nope.
When did your wife pass away? What month was that?
That was in,
June,
July.
July.
Okay.
July.
So nothing in there, nothing
No.
that's been bothering you recently?
No, that's what I don't understand.
Been talking about the pacemaker a lot.
Does he have a pacemaker?
No,
No, you were saying that I might need that if I get lightheaded and this and that. My
Did you pass
pulse,
out?
my pulse are going real low.
How low is it?
Here, it's right here, Doc. I got a nurse coming to the hospital. I mean, to the hospital.
You're at 57 today. 47? Okay, that's kind of low. Did you pass out?
Not yet.
Okay,
I keep on feeling like I am going to.
okay. Well, we can always put a pacemaker in, we just don't know if it's gonna actually resolve the problem. But at 47 is kind of low, you know, and if you feel lightheaded, dizzy, and we think that you're related to the slow heart rate,
That's what I'm up into. I don't
but
know.
we haven't documented it. The
Right.
heart rate is
I'm leaving it up
57, so until I document it, it's very hard for me to
Right.
justify a $30,000 device. So, you know, I have no issues doing it, but unfortunately, unless you pass out and it's documented with a slow heart rate, like in the emergency room or
Right.
by a paramedic, you know, or a seizure or stroke, I hate to say that, it's very difficult to justify putting one in. And so we would hate to put one in, go through the complications of infection, bleeding, and redos,
Right.
and then we say, shit, we really didn't need one. And no one can answer that question. Another thing we could do, a halfway approach, instead of a pacemaker, is we could just set you up for one of these. This is very easy. This is a loop recorder. That's a very good device to put in you. This is not a pacemaker, but it's an implantable device that monitors his heart all the time. So this will give us more information. It
right.
takes 20 minutes, it's a local anesthetic. You go home in 2 hours, in and out of the hospital very easily. We don't even put you to sleep for it. So this is a memory stick. Basically, it memorizes your heart. So that's why it's this big. It's a battery
Where do you
memory
put it?
stick. Well, it actually goes right above the heart. So you know how your ribs are right here?
Yeah.
Okay? And we have our breastbone. So there's a little space in between the two. It goes kind of like this.
Right under the skin, right?
Right under the skin. It doesn't even go inside the muscle. It doesn't go into the heart or the lung. It's just under the skin.
Right.
And it's closed, so it's very easily in and out. Takes about, it's 100% covered by insurance. I don't need an authorization for this. I can get this put in a month or two, I mean in a couple of weeks, very easily scheduled, and it gives it more information.
Right, I just keep a record of the
Yes,
heart.
so it's called a loop
24 hours,
recorder.
yeah.
It records the heart rate all the time.
Right.
The battery lasts about a year. And what's nice about it is, he can say, okay, on his birthday, February 25th, let's say, I felt at 8 o'clock really bad. And when he comes to the office, we can put a little
Plug it right
machine that goes through the skin, little sensor on top of it.
It
You know, it's
extracts
underneath-
all the info.
it sends it wirelessly. It's really cool stuff. And we can actually look at anything we want. Plus, If he gives us a date and time, we can look at that more carefully.
Right.
But it's going to be looking at all the lowest heart rate. And if we see it dip down to the 40s, then it's easy to fix.
Yeah.
You know? So this is a loop recorder.
And it's documented, like you
It's
said.
documented. Because part of the problem is we don't have it documented. You know?
Yeah.
Mhm.
Because everything we do is invasive at this point.
Yeah.
It's another angiogram. I got the report from this, by the way, and I'm glad you showed it to me. It actually looks worse on this than the report.
Oh.
They read it as 60%, but to me it looks a little worse in some of the pictures, you know?
Yeah.
But what beautiful images.
Yeah.
You know, just beautiful images.
I'm scared to even drive.
Well,
Then
what do you
I get
care
dizzy.
about?
I get dizzy or
You're
something.
getting dizzy? Okay. Well, then I think we should go ahead and put that loop recorder in. And you did have dizziness starting about 2 years ago, by the way. You were actually in the hospital in December, and you had another episode last April. And it could also be related to the allergies and hay fever, and causes congestion and more dizziness. And then when it's summer and not so much junk in the air, it goes away. That's a very common thing. So let's go conservative. I would suggest we maybe put this in. I'll give you some stuff to read about it, okay? The other things to do invasively would be a pacemaker, which is more, but I'm not there yet. That's okay. Heart rate today is 57. So I know she got 47, but her pulse is not accurate enough for Medicare. Because the reason is if they have a skipped beat, it will misread the count. And so, you know, you have to have it documented electrically, okay? So we don't know it was really 47 when she took it. Right? We don't have an electrical strip. It's just she measured
She had one
47.
sitting up with my finger. You know.
Right. Those things are not, they're not considered accurate enough because they could be wrong. So electrical can't be wrong because you're actually watching it.
Yeah,
A
exactly.
monitor, an EKG, a loop recorder, it's an electrical recording that's very, very accurate.
Yeah.
But pulse from blood pressure or someone taking the pulse or the little machine, those little cuffs, they're not as accurate. They could be wrong. And to put a $30,000, $40,000 pacemaker device unnecessarily is not a good
Right.
idea.
Yeah.
And once again, you haven't passed out, you haven't had a seizure, you haven't had anything major happen. You just have this uneasiness. And the reality is we have no freaking idea what that is.
Right.
Point blank.
You're right.
Okay? So there are doctors who can do it unnecessarily. I'm not one of those doctors. I'm very careful what I do. And the last thing I ever want to do is harm. So it's not that I can't fix stuff. People fix it all the time.
Right.
But I just don't have a reason. And I also don't want to promise you. I don't want to say, Philip, we're going to put this in and you're going to feel much better. What happens
Right.
if you don't? And then you had it done unnecessarily.
Right.
Right? Okay. So we're not bad enough to do it. We can do this, a monitor. We can do, but everything else at this point really is invasive. So instead of repeating a CAT scan, we may do an invasive angiogram and
Right.
look at that carotid. But see, this is okay with me to do. No problem with it. I was planning to do it this year anyway, because I figured last November this was 60-70%.
Right.
And I figured we would wait till this fall or summer and then repeat it invasively, which I told you in the past.
Right.
Okay, I'm consistent. Okay? This is easy. St. Rose, in and out, 2 hours, 3 hours of your time, and we can take care of that for you. Okay?
You should get that, and it'll maybe put them more at ease to know, have a record of.
Oh, much more.
You
You
know.
know, no anxiety then, you know?
Right.
What's your first name, sir?
Mine?
Yeah.
Philip.
Philip.
Right there.
Are you a son or related?
Yeah, son.
Okay. I know you came before, but I forgot. Do you live in town, Philip?
Yeah, I live with him.
Oh, you do, okay. Now, Doctor, this is an MRI of the brain, not a CAT scan.
That was taken a while back.
Oh, okay, because it looks pretty good. This was done on March 20th. This was done in November.
Oh, yeah, this one was just done, yeah.
Yeah. And you haven't had the results of that, right?
No.
Okay. So the lowest heart rate I saw from your nurse was 47.
Right.
And that's okay. It's not low enough to put a pacemaker in either. You know, the average heart rate for an NBA basketball player, great athlete, is actually 19 when they sleep, resting heart rate 38, peak heart rate when they exercise 75. Of course, they're conditioned athletes.
Yeah.
So when we say the normal 60 to 100, it's a relative term. Now, a heart rate below 40 consistently is reasonable to put a pacemaker.
Okay.
But 47 is not there yet. And once again, it could be off. So it's not that I'm not disagreeing with you, I'm just telling you, I don't see
Right.
anything bad. And I don't want you to be worried about anything. Okay? Great.
Okay.
And so I'll just kind of make a note of what we need to do. We can keep our next appointment. I'll get a monitor and I'll schedule you for a loop recorder. If you change your mind, it's no big deal, but I'll put you in the pipeline to get this
Okay.
done. And I think I have an opening in 3 or 4 weeks at
Okay.
St. Rose. Is that okay?
Yeah.
Great. And if you change your mind after you read about it, won't hurt my feelings, okay? We don't want to, we're not like a salesman on a car, we don't force you to anything. But I do think you're a good candidate for it, okay?
Yeah.
Now, while we're waiting for the loop recorder, we'll get a monitor anyway for 24 hours, a Holter. We could do 1 or 2 of those, and they're useful. And if we happen by chance see that the heart rate drops before I see him in a couple of weeks,
Okay.
I can save money and not do this
All right.
and go right to a pacemaker.
Okay.
Does that make sense?
Yeah.
Okay.
The monitor you're speaking of, is that something we can bring home? Or we
Wear
gotta
it for
go
24
buy?
hours, you come here,
Oh,
you
come
put it
here?
on your body, 3 leads, and you go
Okay.
home and you wear it for 24 hours and
Okay.
take it back.
All right.
It's very, very simple to do.
Okay.
Have you had one of those before?
No, I don't think he has.
Oh, that's incredible. Should have done that. Sorry. You went to Texas during the Christmas. You did really well then, right?
No, I didn't go to Texas, no.
He was supposed to. He didn't go.
Oh,
Yeah,
you were gonna go to Texas.
Yes.
Okay. I think sometime on the holiday you mentioned it. you know?
Right.
Yeah.
I gave you some Benadryl and so you got some nasal spray by Dr. Leanne. Did that help?
Spray?
Yeah, the nasal spray and the allergy medicine.
No, I had no problem with that. I mean,
Do you remember the spray he gave you for your nose?
Yes, yeah,
Did you try it?
yeah,
Okay. And nothing good or bad on it?
right.
That's fine, as long as you tried it.
Right.
And these were done at West Valley Imaging?
Yes.
Couple of weeks, okay?
Alright.
And we're gonna hold his Plavix and aspirin. He doesn't really have to, but that's what we usually do, you know?
Mm-hmm.
And was this a routine visit or?
Today?
Yes.
No. He wanted to come in.
Okay, he doesn't need prescription refills. So the only thing I'm gonna do is, because of the lightheadedness and dizziness he's having, I could drop the Benicar a little bit. Blood pressure may go up a little bit, just in case it's the medication.
Okay.
Let's do that, okay?
All right.
Don't think so, but you know, trying to think of everything, you know?
Mm-hmm.
Just to see if we do something, you know?
Mm-hmm.
And when do you see Dr. Leanne on the results of the scan? Because that's okay, you should do that, I want you to.
Okay,
Is that okay?
yeah,
And you could just tell them that, you know, I didn't see anything bad yet. We're gonna do a monitor and maybe put an implantable one in,
okay,
but not bad enough to do a pacemaker yet. We're not there yet, okay?
okay.
And you're gonna see him soon, you think?
Yes,
Okay. Well, very good.
and you want to see the MRI, right?
Let him look at everything. I'll get the results, don't worry,
Okay,
okay? And I'll send Dr. Leanne a quick note about what's going on,
oh, okay,
so he kinda knows what I'm doing, you know?
okay.
And we'll do that rhythm thing for you when you get a chance, okay?
Okay.
The monitor.
When will you do that? Like he'll come in
Next
whenever he
week or
wants
two.
to, or are you
We
gonna
have
an
set
appointment?
dates and times,
Okay.
and we'll take care of that for you.
All right.
And then did he get a thyroid test?
I don't know.
It's the only thing, no heart failure. Wonderful, wonderful, wonderful. They'll need a thyroid test before we actually put a pacemaker in.
Okay,
But it was done last May, it was okay, you know?
okay.
Good. So the Benacar, I'll give you a new prescription for it.
Okay,
It's gonna be just 20 milligrams, okay?
What is it now?
It's right now 40, so all I did was drop it. Blood pressure will go up 5 points, but it may make him feel a little lightheaded, dizziness, less
Okay.
when he stands up. And it could be just that he's a little over-medicated. So we're doing the obvious, right?
Okay. Yeah. That's what I figured.
It's good to have me check things, okay? Great. That's for you.
yes.
You actually don't need prescriptions right now, and I'm
Okay.
gonna see you in a couple of weeks anyway. So we'll just wait in case we wanna make another
All
change,
right.
you know?
Yeah, you don't need this, do you?
I do not.
But what about these here?
Those I'm gonna have, I looked at them,
Okay.
and I'm gonna give them back to you,
Oh, okay.
and I appreciate you showing them to me.
But you, oh, you want me to take them with now?
Yeah.
I want to take them to Dr. Leave them in your car, okay?
Okay.
I love the images, and I'm glad you showed them to me.
Okay.
I'll be honest with you, it's with that stent you had in the past, the best way to diagnose your neck artery is, you know, if you have a mini stroke, I hate to say that,
Right.
with the Plavix it shouldn't happen, but if you did have a little transient mini stroke, it'd be transient loss of function and numbness
Right.
on one side of your body. It would be transient and go away right away. Or if you had a real passing out episode like you had about 2 years ago, you know, at those points, it's simple to get you documented and see what's going on.
Right.
But the reason they don't put stents or surgeries is if you don't have that problem, then if you do the procedure and there's a small risk of a stroke during the procedure, then you kind of go back and say, well, why did we do it and
Right.
made the patient worse? So that's really why they don't like to do these
Right.
things unnecessarily, and I try to follow that.
Right.
I mean, you know, that's really what the guidelines suggest, that wait till you're sick enough, and you're not sick enough. You're just having some mild lightheadedness, dizziness, and you're worried, but it's not
Right.
bad enough to do anything.
Okay.
And the reality is it may have nothing to do with your, you know, because, you know, as long as you're in Plavix, you got a 98% guarantee you're not going to have a heart attack,
Right.
stroke, or death.
Okay.
Okay? And it's such a good drug.
Right.
And your heart rate today is 57 beats a minute, so it's not slow enough to make you better. So if you feel bad today, and your heart rate's 57, and your blood pressure's good, then I can't make those better
Right.
than making you feel less dizzy today. You know what I'm saying? Now, if you were dizzy and your heart rate was low, then I can tie the two together. But, you know, I just don't see anything bad. But, you know, we'll drop the Benacar, and we'll do a monitor, and we can set the loop recorder. That's easy. I can even get a second opinion with another doctor, like what I do, electrical.
Right.
I got guys who do that too. Just like I have my friend Dr. Barber helping
Right,
with the legs.
yes, right.
I got cardiologists who do electrical work too. So it won't hurt my feelings. We can do that too. Whatever you want to do, I'm here to help.
Right.
I'm just trying to explain to you that, you know, I don't see anything that I'm worried about. And I don't see anything bad on the scan, but I'll get the official report. Dr. Leanne will go over it with you, okay?
Alright.
Okay, good. So hold on a second, okay? Gotta just change that one Bennett car.